was the last time your adult child asked for your opinion about something significant in their life and then actually incorporated it into what they decided? I want you to think about that carefully before you answer, because the answer is more interesting than it first appears. Many women I know, when I ask them this question, start to answer confidently and then pause. And the pause, which arrives partway through a thought they believed was going to be simple, tells me something specific about the relationship they are describing. I want to be clear about what I am and am not saying before I begin. I am not saying that adult children who love their parents are above the behaviors I am going to describe. What I have observed, and what I think is worth naming directly, is that the gradual process by which some adult children begin to treat their aging parents as a category rather than a person tends to happen quietly, without anyone intending it, in small and specific and individually unremarkable ways. It happens in families where the love is genuine. It happens out of anxiety as much as out of dismissiveness. And because each sign is small on its own, it is easy to dismiss each one individually while missing the pattern they form together. These are not signs of a failed relationship. They are signs of a relationship that is drifting in a particular direction and that still has room to be redirected if both people are willing to look at what is actually happening. Leave a comment below as we go if you recognize any of these and if you have found something that helped. I think the conversation around this topic is more useful when it is specific rather than general. The first sign is the consultation that is not actually a consultation. Your adult child asks for your opinion about a major decision, a purchase, a family matter, how to handle a situation with the grandchildren. You give your honest view, and then they proceed with what they had already decided before they asked. This happens once, and it is nothing. This happens as a consistent pattern, and it is a sign that the consultation is something else, a courtesy, a formality, an acknowledgement of your place in the family that does not extend to a genuine willingness to be influenced by what you say. What I want to say about this sign is that it can emerge from the best intentions. An adult child who loves you may ask your opinion partly because they know it matters to you to be asked, and partly because they have learned over time that their choices and your recommendations diverge often enough that they have quietly stopped treating your input as actionable. Neither of these motivations is exactly dismissive, but the cumulative effect is the same. You are included in the form of the decision without being included in the substance of it. Noticing this is not about assigning blame. It is about understanding accurately what kind of role you currently occupy in your family's actual decision-making and deciding whether that is the role you want to continue in. The second sign is when they begin to explain things to you differently than they would explain the same thing to a peer. More slowly, more loudly in certain contexts, with less complexity and more repetition, with a particular quality of patience in their voice that is not the patience of a good conversation, but the patience of someone who expects to have to say it again. If you have experienced this, you will recognize the specific quality I am describing, because it does not feel like respect. It feels like a category, the category of someone whose comprehension is treated as unreliable in advance. What is actually happening in these moments is that your adult child is responding not to you specifically, but to a general assumption about what aging does to a person. They have absorbed, as the culture broadly has absorbed, an association between advancing age and diminished capacity, and they are applying that association to you on the basis of your age, rather than on the basis of anything you have actually demonstrated. The response to this, which I have found useful, is to engage at full complexity when the moment arises, to make the full observation, to use the precise term, to demonstrate, without making a performance of it, that the capacity they are preemptively protecting you from using is entirely present. The third sign is when your schedule begins to be treated as infinitely available. Plans that involve you arrive at the last minute, without the advance notice that would be extended to any other adult whose time is worth considering. An invitation for a holiday arrives 2 weeks before. A request for you to watch the grandchildren comes the day before. A change to plans that affects you is communicated after the decision has already been made. Each instance has a plausible explanation. As a consistent pattern, it tells you something about your implicit status in the family's thinking. Your time is treated as available because the assumption is that you do not have commitments that compete with theirs. This is one of the quieter signs because it is so easy to accommodate and so difficult to name without appearing ungracious. Of course you are glad to help. Of course you want to be included. The question is not about the request itself, but about what the manner of the request reveals about how your time and your life are being understood. A woman whose adult children extend her the same consideration they would extend to any other adult in the family is in a different position than one whose schedule is managed as a flexible resource. The difference is worth noticing. If you enjoy this channel and want to support my work, just look directly below the video player, right next to the subscribe button, and click the button that says Join. That is how you become a Smart Organizer. Smart Organizers members get exclusive videos, a loyalty badge in the comments, and custom channel emojis. I would love to have you there. The fourth sign is when you become aware that decisions about your life or your situation are being made in conversations that happen without you. Not emergency decisions and not minor logistics. Substantive conversations about where you should be living, whether you are managing well, what might need to change. You find out afterward, either because someone mentions it or because a conclusion arrives that was clearly preceded by a discussion you were not part of. Or you sense it in the way a subject is raised with an unusual degree of shared framing, as if the position has already been agreed on before the conversation with you begins. I want to say something direct about this sign because it is the most significant of the 8 and also the most understandable. Adult children who love an aging parent and who are genuinely worried about that parent will sometimes have preliminary conversations among themselves before raising a subject directly, partly from wanting to approach it carefully and partly from the genuine difficulty of discussing a parent's vulnerability with the parent herself. This is not malice, but its effect, regardless of intention, is to move you from the center to the edge of decisions that concern your own life. The clearest response, when you become aware of it, is to make the expectation explicit, that you want to be in the conversation, not to receive its conclusions. The fifth sign is when the questions stop. Not the practical questions, those about your health, your plans, your needs may continue. The questions I mean are the ones that treat you as a person with an active interior life. What are you working on? What have you been reading? What is occupying your mind? What are you curious about right now? When those questions stop arriving, replaced entirely by the logistics of your well-being, something has shifted in how you are being held in the relationship. You are being cared for rather than engaged with, and the distance between those two things is the distance between being treated as a subject and being treated as an object of concern. This sign is the one that women tend to feel most and name least. It is painful in a way that is difficult to articulate because it involves not a thing that happened, but a thing that is no longer happening, and the absence of something is always harder to name than its presence. If you have a project, a passion, a subject that currently occupies your thinking, and the people closest to you do not know about it, that is information about the quality of engagement in those relationships. It is worth noticing without immediately deciding what it means. Tell me in the comments whether any of the first 5 signs I have described reflect something you have recognized, either in your own family or in the experience of someone near you. I find that the most useful parts of this conversation tend to be the specific ones. The 6th sign involves the grandchildren, and I want to describe it carefully because it is the most subtle of the 8. There is a quality that begins to appear in some visits once the adult children have formed, without necessarily being aware of it, a particular kind of uncertainty about you. The grandchildren are present, and so are you, and so is a quality of monitoring in the adult child's attention that was not there before. The visit feels supervised in a way it did not used to, and the supervision is not about the grandchildren's safety or behavior. It is about something harder to name, a low readiness to intervene, a management of the time together that treats your unsupervised relationship with the grandchildren as something that requires oversight. I want to name what usually produces this, because I think clarity is more useful than resentment. In some cases, it comes from a genuine shift in the adult child's assessment of you as a reliable presence. In other cases, it is simply anxiety, the desire to control a relationship they love from a position of oversight rather than trust. In either case, it is worth addressing directly if it is present, not as an accusation, but as an observation. Our time with the grandchildren feels different than it used to, and I would like to understand what changed. The seventh sign is the surprised compliment. You manage something, understand something, solve something, and the response carries within it a quality of surprise that the thing was accomplished at all. Oh, you figured that out. I did not know you knew about that. That is impressive. The compliment itself is warm. What makes it a sign is the surprise inside it, the baseline expectation that you would not have managed it, that this level of competence is above what was anticipated. What is being revealed is not how the person feels about you, but what they have quietly assumed about your capacities. This is one of the more correctable of the 8 signs, because it responds to consistent demonstration better than it responds to conversation. A woman who continues to engage fully with her life, who stays curious and takes on challenges, and remains genuinely interested in the world, gradually shifts the baseline expectations of the people around her simply by continuing to be herself. The surprise compliment has a way of disappearing when the surprises stop being surprising. It requires patience. It is worth doing. The 8th sign is the repeated summary. The same information explained to you twice in the same conversation, as if the first explanation might not have taken. A plan described and then described again from the beginning a few minutes later. A conclusion stated and then restated in different words immediately after, as if the first statement was insufficient. The repetition is done with good intentions. In most cases, the person doing it does not notice they are doing it. But what it signals is an uncertainty about whether you are fully present and following, an uncertainty that would not be extended to anyone they were treating as a capable adult. This is the hardest of the 8 to respond to directly, because naming it in the moment tends to produce defensiveness rather than any real awareness in the other person. What I have found more effective is to demonstrate retention, to refer back to what was said earlier, to build on the first explanation rather than simply receiving the second one, to make visible by the texture of the engagement that the information arrived the first time. This is a quiet form of advocacy for yourself. Done consistently, it changes the expectation in a way that naming the pattern rarely does. I want to close with what I think is the most important thing to say about these 8 signs taken together. Individually, each of them is easy to dismiss, explain away, or absorb without comment. That is why they tend to accumulate without being addressed. But the pattern they form together, when they are present in the same relationship over time, is the pattern of someone being gradually moved from the center of her own life to a position of managed concern. Naming that, even privately, even only to yourself, is the beginning of addressing it. Relationships between aging parents and adult children can be renegotiated. Not easily, not always, and not without some willingness on both sides. But the renegotiation can only begin when the person being managed stops accommodating each individual sign as if it arrived in isolation and starts seeing clearly what the signs together describe. Tell me in the comments which of these 8 signs is most recognizable to you and whether there is something you have found that helps. This is one of the more complex conversations that women of our age are having, and I am always interested in what the specific experience looks like. And if this is your first time here, I would be glad to have you subscribe. I will see you in the next one.